Hi friends, today we have Shahrukh with us. So we did surgery for Shahrukh around 1 year back, and it was
3000 FUT.
3000 FUT surgery, and it was done almost a year back. And few important things, as you can see, how does the growth look like?
It's great.
Looks
Super.
good, nice.
Super.
So, there are some important technical facts which I want to discuss with you guys, and please stay tuned and listen to the complete video. It's very important, and few things you will definitely take home from this. So, as we can see the pictures over here, you had quite a bit of baldness and thinning in the frontal area. If we see this, then obviously this picture over here, then the sides, that there was loss of temples on both the sides. We can see here, here, here. It was very broad, and generally and it's more or less empty over here. If we see, no growth, almost no growth. And the important thing is, even the middle portion, if we see this picture here, we can see up till this area there is a significant thinning. So that's a huge area which we plan to do. And for this and that much of width of the face, 3000 is a small number, and you definitely need a bigger number for that. I think at the time of your surgery we discussed this also.
Exactly.
I gave you choice to increase the number.
Exactly.
But maybe
We are okay with
yeah, we are okay with. So now this is important because you will see such cases on internet, and even with shaved off head, like pre-pictures people generally shave off, so it looks even more bald.
More.
So you will find people doing 4000, 5000 grafts in these areas, even more sometimes, and along with that giving 1 mg finasteride per day. So now the result which we have got is 3000 FUT, and as you know, Shahrukh, there is a difference between FUT and FUE, because FUE gives us choice to choose multi-grafts, cherry pick, so more number of hair per graft. So suppose if we are doing 3000 FUT, then that means FUT multiplication might be 1.5, so that would be like somewhere around 4500 hair. But if the multiplication is 2, 2.3, 2.4, 2.5, which can be there in case of FUE, so the number of hair which you get becomes manifold. That means if the multiplication is say 2, and we are doing 3000, that means 6000. And if it is more, 2.2, then it may become 7500, 7000, 7500. So we cannot compare the result of 7500 here with 4500 here. So that's a huge difference. Out of these two techniques, FUE gives you more density for the first surgery. But if we are repeating FUE again from the same, or even if we are doing FUT after doing one FUE, then obviously all the multigrafts are gone from there. So even if you think that okay, let me choose a technique or let me do the maximum density, you are limiting your options for future, which is very important. And let me tell you again, see, here is it is the better term would be hair journey, not destination. So hair transplant is a journey, not a destination, and it is not a one-time thing which you do, because hair loss can be progressive. Now, coming to the transplantation, we did the surgery over here, and we can see how nicely the grafts were placed. Obviously, 3000, so we have placed less number of hair in this portion, and then the hairline, and then the temple jaw, both the sides. So the hairline and the temples, they look awesome, and I think
That's great.
yeah, nobody
is able to recognize also.
that's great. Now, post transplant, we have given you minoxidil, which you are applying on alternate days, 3 times a week almost.
Exactly, 3 times a week, so sometimes even 2 times a week.
And secondly, you are using finasteride, which is
twice a week.
Twice a week. So he is taking 2 mg finasteride per week, and minoxidil 2 to 3 applications per week. Now, why did we give this? What's your age, Shah?
26.
26. and we can see the grade of baldness is quite high. Now, if we compare the recent picture which I just claimed and showed you, in those areas we can see there is improvement in thickness.
Thickness also.
So that means this has responded to the medication which we are giving. Now, with just 3000 grafts, it obviously won't have been possible to cover the entire thing.
Of course,
We have to plan, we have to spend our resources wisely. We cannot just blindly, do things. So, this is 2 mg per week. If we give 7 mg per week, you can very well imagine what will happen to the density will be improved so much so that it looks, it starts looking very, very dense. But then the reason why I generally don't give this at that dose, and in many cases, in most of the cases rather, I don't even start. But in your case, we had to because the thinning was like extending till there, and so if we give 7 mg per week, that means more growth, more improvement, but lesser time span of the medicine because the body will get tolerant to the medicine very soon. So with this dosage we have options to increase the strength. As we see, the graph has started dipping down. Okay, we have not done PRP post transplant.
No, not at all. Not yet. Not yet.
Not yet. So again, a myth. People think that you need 7, 8 PRP sessions, and do you really think that? I mean, getting injections on the scalp is fun?
Yes, of course, not at all.
So, see, what is the fun people are getting doing so many PRPs? I really don't understand because I have not seen it working. And in fact, even without transplant, I have seen people doing 6, 7 PRP sessions, which does not make a sense. Does not make. And it's not like our growth is falling and the hair have gone and or finasteride would have this PRP would have boosted it. That's not the case. So but people are blindly following this, and you came from Hyderabad.
Of course.
So suppose getting a transplant done in Hyderabad would have been easier to you, and especially keeping this thing in mind that people need PRP followed by that, and you can come once, but you cannot come for 6, 7 times again and again. And if you don't come, at the back of the mind you feel I am missing something, and something so beneficial, extra service which was being provided to me,
but I'm not getting,
so I'm missing out. So, but that is not the case. Come on, see, use your brains. In I have been doing transplants for 20 years now, and not in a single patient we do PRPs post transplant like this way. Like maybe 6, 7, 8 months I do one PRP, and then generally yearly PRPs, because first of all you will have to ensure whether what you are getting in the name of PRP is actually PRP or it is something else. And second, you will have to understand that you know multiple sessions can induce tolerance. Even if it is true PRP and it is working, it will induce tolerance and you will be in big trouble. You will lose a very reliable ally of yours, which can be, which can save your hair for a long period of time. So overusing the resources does not make any sense, be it medicine, dosage, duration, or PRP numbers, or graft numbers, or technique. Okay, so I think why did you choose Satya, by the way?
Of course, I choose just like I saw so many clinics and I saw so many videos, I saw so many reviews, and I found it great. That's why I choose Satya Clinic.
You were planning to go abroad?
Exactly, I'm planning to go abroad also. I was planning to go visit to this Mumbai also. There's so many clinics are there. Of course, you would have known. But at last, I selected this. I found it's genuine and little. I saw reviews and everything.
Now, what do you say after?
Of course, it was great. It was good decision. It was a good decision.
Good decision. Good, great. So now, see, I'm mentoring your journey of hair loss and hair regrowth and prevention of hair loss. So I, like a true mentor, this is my job to ensure that I don't overdo my resources in the beginning itself. So we are a team, and we are targeting next maybe 7, 10 years. with the limited resources, and definitely with a big knowledge in our mind that hair loss can be progressive. It does not care for your emotions. It does not care for my hard work. Okay.
Of course.
So we have to respect this and accept this. Okay. We cannot just blindly give blanket treatments to everyone, each and every patient who is getting a transplant done. Okay, take 1 mg finasteride, take, apply minoxidil twice
It
a
can't be
day.
same in everyone's case.
That cannot be same. See, now in the frame you are watching two transplant patients, myself also.
I know that.
And I am not taking minoxidil, not taking finasteride. After 1 year of my transplant, I have taken one PRP session. That's it, and yeah, that's it. So I don't need it. His age is different. My age is different. His hair loss condition is different. Mine is different. His donor is different. Mine is different. So everything is different. So how can the treatment be same? Come on, use your brain. That's so simple. So simple. Now, doing a transplant with less number of grafts and still giving, and with less medicines, okay, and with less number of grafts per less number of follicles per graft, because of the technique we have chosen, FUT and FUE. Now, if you see this and compare it to the result which you are watching on internet, which is loaded, bombarded with finasteride 1 mg per day, all the multigrafts have been exhausted and the donor is gone, and then and crazy numbers of PRP again and again and again. If you compare, and again the number of grafts are also on higher side on in those clinics. Did you find this consistency in the work which we are doing?
Of course, I know.
With less number of grafts, we are able
yes.
to, and this needs skills, serious skills. This needs a lot of patience, and this needs years of hard work, and this needs an intent to help, and honesty and transparency. Otherwise, it cannot be done. Okay, so but you will find a lot of people heavily relying on not actual hard work. So if we see, this is the work by 3000 FUT and 2 mg finasteride per week. So if we take a look at the hairline, it looks pretty nice, very good. And the temple work was also done on both the sides. We can see over here. The nice temple has been created. The other side also. You see this, very nice temple work has been done. And if we see this, it looks pretty good. Now, head down please. So if we compare it to the previous picture, let's see what kind of growth Shahrukh has in this portion. So see, this is the growth, hair growth, which we can notice in the middle portion. This was the most densely placed area. We did not do much grafting in this portion. These are, mind you again, this is like just 3000 grafts. This portion, if you compare the pre-pictures to this, now this portion has improved actually from what we can see in the pre-pictures. Over here also we can see some improvement, and this is just 2 mg finasteride per week and 2 to 3 applications of minoxidil per week. Now if I increase the dose to 1 mg per week, so this area is gonna fill like crazy. This gaps will fill, and and even this portion, the frontal portion, will improve a lot, and there will be a lot of thin and miniaturized hair which will come in these areas also, and these areas will look more full, and and because of the appearance of very thin softer hair in this portion, the hairline will look amazingly great, and even now it looks very very beautiful and natural. But yes, with the help of finasteride, it can be made to look out of the world. If you want a true assessment of your condition, your donor, and your hair, you can fill the contact form given I button, also description also. We have an Insta channel also which you can see, and a lot of different information and stuff is posted there as well. Thank you. Love yourself.